from the Thurston County Board of Health meeting for Tuesday, March 9th, 2021, 3:31 p.m. My name is Menser, Chair of the Board of Health. Present is Vice Chair Commissioner Carolina Mejia and Commissioner Gary Edwards. We also have County Manager Ramiro Chavez, as well as our County Health Officer, Duniana Abdulmalik, and our Public Health Director, Schelli Slaughter. Calling the meeting to order, we will need a motion regarding approval of today's agenda.
I move to approve the agenda for March 9th, 2021.
Second.
Been moved and seconded. All in favor, say aye.
Aye.
Aye. Motion carries. Agenda is approved. I'm looking for a motion regarding meeting minutes from February 9th, 2021.
I move to approve the meeting minutes for February 9, 2021.
Second.
Been moved and seconded. All in favor, say aye.
Aye.
Aye. Motion carries. Those minutes are approved. Item 2 on today's agenda is proclamations and presentations. Under this item, we have the proposed proclamation for racism by the Board of Health. And I'm going to ask our Director of Public Health to introduce this proposed proclamation.
Thank you so much, Mr. Chair. Schelli Slaughter, Director of Thurston County Public Health and Social Services. Earlier this afternoon, the Board of County Commissioners took a very important and historic step to pass a resolution declaring racism a crisis here in Thurston County. And today, I'm here today to ask the Board of Health to take another long overdue step to acknowledge that systemic racism is impacting the health and well-being of our residents in Thurston County. Black, Indigenous, people of color in Thurston County experience racism that impacts their health, well-being, and length of life. Race should not be a factor in health outcomes, but racism is. Racism impacts the physical health, mental health, child and adolescent development, our infectious disease and chronic diseases, including COVID-19, public safety, housing, and environment. The Thurston County Board of Health has proclaimed the homeless crisis and the opioid crisis a public health emergency in the past couple of years. As we heard from Dr. Thelma Jackson earlier today at the Board of County Commissioners, racism is a pandemic that has been here for hundreds of years here in Thurston County. We have many people and community partners here with us today that I believe would like to speak on behalf of this proclamation and join us in asking the board to make this very important proclamation today. And with that, I will pass it back to you, Commissioner Menser.
Thank you, Schelli. And we will have an opportunity for the public to address the board in the next section. But at this point, there is a proclamation, and I would offer Vice Chair or one of the board members to present that.
Am I reading it? Okay. So Thurston County.
Sorry, I was just going to clarify. Unlike the Board of County Commissioners, which was in the form of a resolution, we will be reading this proclamation.
No. Okay. So Thurston County proclamation: racism is a public health crisis. Whereas racism is a public health crisis affecting the residents of Thurston County, and whereas racism and the impact on public health and medicine has a history stretching for 400 years in the United States, and whereas throughout history, systemic racism has manifested as discrimination and oppression directed toward communities of color, resulting in trauma and harm to the health and well-being of the targets of racism, their families, their communities, and subsequent generations. And whereas systemic racism is institutional and structural, and racism is a system that structures opportunity and assigns value based on the social interpretation of how one looks. And whereas race is a social construct with no biologic basis, and whereas systemic racism itself is a social determinant of health, and whereas racism is a root cause of constricted economic and social mobility, and whereas the health impacts of racism are well documented, over 100 studies have linked racism to worse health outcomes for communities of color, and whereas to achieve the highest level of health and well-being for everyone, we must reduce and eliminate disparities. And whereas racism results in disparities that can be seen along a wide array of public health dimensions: physical health, mental health, child development, education, employment, public safety, environment, and housing. And whereas the Board of County Commissioners is declaring racism a crisis in Thurston County, and whereas the Board of Health exists to protect the public's health in Thurston County. Now, therefore be it resolved, the Board of Health hereby proclaims racism a public health crisis in Thurston County and commits to a course of action that reduces and ultimately eliminates health disparities so that optimal health for all is possible and race no longer predicts health outcomes. And the Board of Health calls on the Thurston County Public Health and Social Services Department as a local governmental public health jurisdiction to expand collaborations and develop new partnerships focused on eliminating health disparities created by systemic exclusion from services and differential access to opportunities. And the Board of Health calls on Thurston County Public Health and Social Services and Thurston Thrives to improve efforts to connect and collaborate with BIPOC, Black, Indigenous, people of color communities for input, consultation, and direction concerning community needs. And the Board of Health calls on Thurston Thrives as a community's collective health impact organization to bring together partners to implement strategies and actions that close the health equity gaps experienced by BIPOC communities in Thurston County. And the Board of Health calls on the greater health care community, inclusive of medical, behavioral, and oral health care services, to raise awareness that racism in its systemic, cultural, and other forms is a serious threat to public health, to the advancement of health equity, and is a barrier to appropriate medical care. And the Board of Health calls on the greater healthcare and social services community to continue to partner and expand efforts that advance racial equity in ways that have local and regional system impacts on the public's health and well-being. And the Board of Health commits to supporting the Thurston County Board of County Commissioners resolution declaring racism a crisis and accelerating actions that reduce and ultimately eliminate the health impacts of racism, adopted this 9th day of March, 2021.
Thank you, Commissioner Mejia. Any comments from board members before we move to opportunity for the public to address the board? I'm going to start with Commissioner Edwards.
Well, I said this at our earlier meeting here as the Board of County Commissioners, but I would hope that everybody could get this through their head, treat people the way you'd like to be treated, and life is better. And the bottom line is we can always do better, and that's what we're attempting here.
Commissioner Mejia, any comments on the proclamation?
I said some words at the Board of County Commissioners meeting, but I guess I'll just repeat that I am very excited that we're doing this on Billy Frank Jr.'s birthday. So that's all I have to say. Thank you.
Thank you. These actions were obviously coordinated and connected, and they're logically connected, but there is, I believe that this is deserving of separate treatment as a public health matter. The work of Thurston Thrives has highlighted disparities in the work of our own public health department. I see Marianne O'Gara. She's worked really hard at bringing data to the commissioners and to the broader community to highlight this. And we need no further than our COVID-19 report from this morning's board meeting, where we see that Black or African Americans are being infected with COVID-19 at a rate double their percentage of the population in Thurston County. Hispanic is even worse. It's about 2.5 times. And these are in line with statistics that pre-existed the pandemic, and they're obviously rooted in a number of causes, but we need to work toward addressing them. So thank you for putting this together. To our public health staff, they worked hard on the elements of this. And we will now move to our opportunity for the public to address the Board of Health. Kind of backwards order from the last meeting, but we didn't talk about, I'll make an executive decision and make this 4 minutes. We haven't talked about public health, a Board of Health public comment period. We have kind of officially adopted a longer period at the Board of County Commissioners, but for today's purposes, it'll be 4 minutes of public comment. I'll go through the guidelines once again in case you weren't here earlier. The Board of Health welcomes comments at all of our monthly meetings, but we have some guidelines to ensure that comments are appropriate. When you're called, please introduce yourself and indicate where in the county you reside. Address the board, not audience or staff. Silence your cell phone. You will have up to 4 minutes to address the board. You may not donate that time to any other speaker. You address the board. The board will not respond to those comments. The county manager or director of public health may follow up on an as-needed basis at a subsequent meeting of the Board of Health. The board reserves the right to restrict the person's opportunity for comment for a good cause. No comments that are lewd or offensive, inflammatory, hateful, defamatory, or discriminatory in nature. No, please be respectful. No outbursts of any kind. No comments that are commercial in nature, such as promoting a for-profit business. No comments about land use or issues that could come before the board on appeal. And finally, all materials you provide to the Board of Health may be considered public records and subject to public release upon request pursuant to the Public Records Act, Chapter 4256 of the RCW. So with all of that, we'll go through the same process where I'll start with the folks in the boardroom have signed up, and then we'll go through our Zoom to take additional public comment. My only sign up on the sheet is John Pettit. So we'll start there.
Good afternoon, commissioners. And I should say Board of Health members. I thank you for this time. I happen to live out off of Rich Road. I have a place called the Deschutes River Ranch. In regards to the recent proclamation for racism, I would assert that racism does not or is not tolerated in any fashion at the Deschutes River Ranch, where I quite oftentimes have a large group of people. So it is the most diverse group of people that you will ever find in Thurston County, and I love it. And the majority of my own personal household would be considered people of color, as they are Asian. Getting on to the issue which I did want to address, particular with this particular time I have, is tomorrow you're scheduled for a board work session regarding on-site sewage management plan. I've already conveyed to the county manager that the initial documents that you had presented represented about 27 pages, but out of the actual plan that was from 2016, there was only 4 pages inserted. And as the county manager will confirm, some of the information is debatable, and I'd previously written a letter and I was acknowledged by the county manager and staff that we may not really be having a 14% rate. We might be only having 0.2% rate for failure on septic systems. This concern is kind of a double whammy because I hear about we have 12 million gallons a day going into septic systems. Well, I think we have to resolve, first of all, out of those 12 million gallons a day, how many wells are actually affected? How many wells have gone bad during this time? Because that's where the concern is about septic systems being in places that may be polluting the aquifer. But we do know this, Lot, it puts in 11 million gallons a day into Bud Inlet. Not 1 ounce of that 11 million gallons is potable water. It's all polluted. So why we want to focus on septic systems is one thing. We may have a much larger issue right downtown that we're polluting our bay. So I'm going to be sending you some additional information tonight regarding some of this, but I do ask that you give special looks and consideration. I'm really not interested in seeing a fee program go across the county. I consider it a tax, and I consider that all taxes have to have uniformity in it, meaning everyone has to be treated equally. So we'll be having further conversation. Thank you very much.
Thank you. Let me go on to the Zoom meeting. So I will call members of the public first, and I will call you on the order that I see on my Zoom screen. First, I have Mr. Dogma.
Good afternoon, Commissioners. My name is Doug Ma. I live in Southeast Olympia in the urban growth area. I'm here this afternoon on behalf of Thurston Thrives. First of all, thank you for the opportunity to address the proclamation, and I'd like to express our support for the proclamation. You'll recall last year, Thurston Thrives approached the commissioners about making some changes to the comprehensive plan, and specifically Chapter 11 around community health, and saw a need to address racial equity from a public health standpoint. Ultimately, those amendments were adopted by the county, and this proclamation is completely in alignment with the changes in the comprehensive plan. And so we really do appreciate that effort and the alignment. And more importantly, we appreciate the specificity and the clarity that the proclamation outlines for the county and the community, and Thurston Thrives regarding how we will begin to address this crisis. It is, again, timely, it is meaningful work, and it is important work. And we look forward to working with you as we make progress on this important crisis. Thank you.
Thank you. Next, I have Mr. David Schaffer.
Well, good afternoon, Commissioners, Board of Health. It is nice to be with you. Doug really outlined the specifics, and there's also a couple chairs of our coordinating council. So I want to make sure they have an opportunity to share, but I do want to first share. It's really been a good experience over the last several months with, actually I'm kind of proud of our community's coordinating council within Thurston Thrives and their effort of looking at the health equity and gap, and the support of the county in assisting us with data and analytics has been very supportive. Collective Impact is a wonderful tool for supporting your proclamation and the efforts of the county. There's probably, when you think about it, no better tool than groups of entities throughout your community coordinating and assessing, and then taking specific strategies for positive outcomes. And within Thurston Thrives, looking at the determinants of health, race should not be a determinant of health. And so, again, supportive of your proclamation, supportive of the county's work in this area. And as a community, we will definitely have some positive impacts on health. Thank you.
Thank you. Next, I have Mr. Derek Harris.
Yes, thank you, Board of Health and Commissioners. I'm here today, Derek Harris, live in Tumwater and work in Olympia. We're in support of the proclamation. We believe it could elevate a collective response of anti-racism work in our community, as well as create accountability for us all to keep this work on the forefront, work beyond a proclamation, but actually get into the weeds of doing the work. As we know that it disproportionately impacts the health and well-being of our Black, Indigenous, and people of color members of our community. At CYS, we've been doing racial equity work intentionally for the last 2.5 years. We felt strongly about signing on to the community nonprofit letter. And we believe that this proclamation is a first step towards getting together to create a collective response to work together to address racism in our community. I say this on behalf of just being a citizen of Thurston County. I say this on behalf of being the CEO of Community Youth Services. And Community Youth Services is in full support of anti-racism work within our community. Thank you.
Thank you. Next, I have Ms. Megan Sullivan.
Good afternoon, Board of Health. Thank you so much for the opportunity to comment. My name is Megan Sullivan. I'm the Deputy Director at Together. As Derek Harris said, Together is one of the signers. Oh, and I live in Tumwater. Together is one of the signers of the racial justice letter sent to the Board of Health and County Commission. I also want to just say that this is a long time coming. I know others have been asking for this. And a year ago, June, we Together and a group of nonprofits had asked the county to consider this measure. So thank you for moving it forward. And as I shared in the county commission meeting, I think it's really important that we look to center the voices of BIPOC individuals in a way that is meaningful and accountable and doesn't tokenize so that we can make the most change in the most, causing the least harm to communities of color. So thank you for the opportunity to comment and look forward to partnering moving ahead.
Thank you. Next, I have Lanise Milam. Moving on. Next, I have Ms. Chris Wells.
Hi, thank you so much for allowing me to make this comment to the Board of Health. I'm here in my capacity as Executive Director of United Way of Thurston County and co-chair of Thurston Thrives to express our support for the proclamation. At United Way of Thurston County, we fight for the health, education, and financial stability of every person in Thurston County. And I look forward to continuing to work with both Thurston Thrives and throughout our community to eliminate the inequities that perpetuate these health disparities. Thank you.
Next, I have Mr. Zachary Stokes. Nope. Next, I have Ms. Amanda Ford. Just listen in. Next, I have Ms. Elissa Sparkman.
No comment from me. Thank you.
Thank you. Next, I have Ms. Melika Lamont.
Hi, my name is Malika Lamont, and I'm coming today to speak as a community member. I live in Thurston County in Tumwater, and also as the chair of the Asset Building Coalition, and as a founding member of BLAST, and before that, Full Circle United. We have, as a member of both of those groups and as a founder of both of those groups, we have not been asked to participate. So to the point of systemic exclusion that was mentioned earlier, we have felt that. That is a felt reality for many people of color in this community, as well as intimidation and retaliation. We are in favor of this declaration. This actually was one of the demands from Black Leaders for Action and Solidarity Thurston County, and we are happy to see that it has moved forward. We hope that we can be part of the, participate in working towards addressing these issues in our communities so that this is not just a performative gesture. We really want possibilities for collaboration and change in our community. Thurston Asset Building Coalition has been working for 3 years on issues of equity, and we are happy to see this moving forward, and we look forward to being able to participate and move this conversation forward. Collective health impacts are a reality that my family has experienced as a Black and Indigenous person in this community, and we're here to help, and we hope that this moving forward will create real change and that there will not be this continued pattern of systemic exclusion and intimidation and retaliation. Thank you.
Thank you. Next, I have Mr. Jeremy Kettle. Next, I have Chris Brown.
Yes, hello. I appreciate the time. I am also a member of Black Leaders in Action and Solidarity Thurston County Blast, and I wish to affirm everything that Malika said earlier. And so I will spend my time on a more personal note of the impact of racism in healthcare. I moved to Thurston County. Sorry, I'm a Thurston County resident, West Olympia. I moved to Thurston County to attend Evergreen in 2002, and at that time, as a poor student, I was on the state healthcare. And the disparities that I experienced between healthcare growing up in Portland, Oregon, and what I experienced as a young adult here, I attributed it to economic factors, the fact that I was on state healthcare. Every time I would seek medical attention for something, things were usually dismissed. Things would be blamed on my race or my body mass index, things of that nature. And I would constantly be told, before even asking for any type of pain management, that I would not be permitted to get any type of like pain management medication, which is usually not what I was there for. I was a very serious student. I'm a very generally serious person, and I don't like being not of my full faculties. So I assumed as in my youth, young adulthood, that these were economic issues. And it wasn't until my mid-adulthood to my early 30s that I realized that these really were racist issues. And that was such a shock to me because, you know, I grew up on a single parent with a state job or a county job or a city job. We had good health insurance. And I had never experienced those disparities or differences in treatment as a child growing up in Portland. But here in Thurston County, it was very drastic and very different. I was declared fully disabled permanent by the state in 2012. I began fighting for federal recognition of my disability in 2014. It's 2021. I am still fighting for federal recognition of my disability because the doctors here in Thurston County are not supportive of people of color in regards to making proper notes of our disabilities, of recognizing things. I've been fighting for use of a walker for my primary care doctor at Kaiser for over 4 years. And these are the things, we can talk about, you know, these issues on these big schemes, but what it comes down to is people are not getting the care they need. And that needs to be addressed, and it needs to be addressed in a very real way. And so, again, I absolutely am in tune with what Malika said. It needs to not be performative. It needs to have results, and it needs to be taken very seriously. And it needs to be approached from the foot, not just of systemic racism, but also of the impact of economic disparities, that poor people and people on state health insurance are treated as second-class citizens compared to those with private insurance. And that's something that needs to be addressed and needs to be dealt with in a way that is not retaliatory. I work with a lot of houseless individuals, and they are so disenfranchised of the medical community here that they won't even seek treatment for things that are very serious. So I hope that the county does better and that you guys look for some real solutions and find paths to holistic care for the entire community, regardless of race and regardless of economic status. Thank you.
Thank you. Last on my screen, I have Meg Martin.
Hello, my name is Meg Martin. I am a unincorporated Thurston County resident in the Olympia area and also the executive director of Interfaith Works. We provide a wide range of services for individuals experiencing homelessness who have the highest acuity and most complex challenges related to physical health, mental health, and substance use related health. And I've been doing that for a very long time in this community and been part of many different iterations of planning and community organizing at the local level and at the county level. And something that I'm just reflecting on right now, I mean, I have countless examples of the ways that systemic racism impacts people's ability to get the care and the support that they deserve. But what I'm really reflecting on right now is that I often hear in all of our planning efforts a real desire to move upstream and to get beyond, you know, the emergency crisis response that we are often really steeped within, because it's a very real thing. And based on things that I've learned from community members that have come before me, many of whom you've heard from today, we have to do both. We have to meet both the immediate need and plan for long-term solutions. And I think that we're always so kind of hungry to figure out how we get to the root of these issues. And I think that taking these steps to really acknowledge and genuinely listen to the people who are most impacted by systemic racism, we are taking a significant step towards addressing a root to many of the issues that we're all working on. And I am grateful that these conversations are being had, and thank you all so much for the work that you're doing to take these important steps.
Thank you. So is anybody else from the Zoom screen who would like to provide testimony this afternoon? Okay. For those members of the public who have joined us via conference call this afternoon, if you would like to provide public testimony before the Board of Health, please unmute yourself, state your name, where you reside in the county. You have 4 minutes. None, sir.
Okay, thank you. Thank you to everybody who in attendance and provided testimony today. We're going to move to item 4 on today's agenda, which is a public health legislative review. We have Art Starry, our Environmental Health Division Director, with us to go through this. And Schelli, do you want to introduce Art and get us going?
Thank you, Commissioner Menser. Art Starry is our Environmental Health Division Director, and he's also our department's legislative representative on WSALFO, which stands for the Washington State Association of Local Public Health Officials. And Art Starry is also the co-chair of our state organization. And so today he will provide an overview of the public health legislative agenda and priorities for WSALFO, and will provide some further discussion and information about bills of importance to the Board of Health. Art?
Good afternoon. I'm Art Starry. As Schelli indicated, I'm the Environmental Health Division Director for Thurston County Public Health and Social Services. And as you know, we're in the middle of the legislative session. And each year when the legislature is about to start, the Washington State Association of Local Public Health Officials and the Washington State Association of Counties develop legislative priorities, trying to identify things that they think might be coming or things that are important to them to work on in the year. Because as you all are all aware, there's only so much effort that people can put forward, especially during the middle of the pandemic. And so they want to really identify the key things that are important to them. And one of the things I attached to your packet is the WSALFO legislative priorities. And I'll go over them really quickly. And then as Schelli indicated, I'll mention one bill in particular and a couple of related bills that are, I guess, of key importance to those of us in the governmental public health system. So one of the things that the WSALFO folks identified, and as Schelli indicated, that's a local association that represents the county health departments and county health districts. They worked with members of their association to identify lists. And one of the first ones, as you might be aware, is foundational public health services. And that has really highlighted the need for foundational public health services. And those are the key services that anybody in the state should be able to expect from their governmental system, that they identified that additional funding is needed for that. And this has been part of a multi-year effort to try to get funding for governmental public health. And I think the COVID pandemic highlighted that there really is a need for the services, the epidemiologist, the disease investigation, being able to follow up on well, some of the other issues that you've even mentioned here today, as far as emerging issues or issues that need to be addressed, whether it's societal issues, being able to provide services like nurse-family partnership. There's a need to be able to do those sorts of things. And the health system funding has been cut or languishing for years. And I think the COVID stuff, even though we've done a good job responding, it's because in part we've also received additional funding for that. So that's one of the key things. Is to provide additional funding and to work with the legislature to provide that. Another thing that was identified and kind of anticipating the bill that I'll be talking about is local governance and authority. One of the things that it's important, I think, is for local health departments and local boards of health and also the county commissioners who are working on health issues is to have some control over their own jurisdiction, not to delegate that. Or that there's a concern about delegating that to folks, whether it be the state or the federal government, because we really do have the best, I think, information about our communities and know how to respond to those sorts of things. And so one of the things that the WSALFO board and the association identified was local public health governance authority as a priority. And if bills came up that might challenge that or change that they would have concerns about that. And that if a process was going forward to maybe change that they work collaboratively with legislators and other agencies to make sure that was being addressed appropriately. So that was a big thing. And I guess not the other big item, which isn't a surprise, is to provide adequate funding for COVID response and recovery. So that, we were obviously in the middle of the pandemic. It's costing, Schelli could probably tell you, or Robin could tell you how much money it's costing to run all these efforts within the department, but it's millions of dollars and it's certainly not anything that's going away soon. And so continuing to have funding for COVID response is important. There's some other issues too I could identify, but those are some of the big ones that were identified early in the process. And if you look at the Association of Counties priorities, you'll see that some of them are related here too. They identified ending racial disparities and social inequities, very related obviously to the proclamation that you just adopted, and also responding to the COVID crisis, excuse me. They also identified climate change and other things, and there's been a lot of bills associated with that have been heard this year and are moving forward. The one big bill though that I'll mention here, I guess stop me if I get going too fast or if you have any questions, is one that has to do with restructuring, or originally started with restructuring the local governmental public health system. And that bill is number 1152. So it's House Bill 1152, but now it's called E2. Anyways, it's been amended multiple times and was recently passed out of the House with quite a few changes over the original bill. But the intent here is the bill is trying to provide tools and resources to help the governmental public health system work better. So the final bill that actually was passed, again, it's called Second Substitute House Bill, was passed out of the House yesterday, which means it still needs to go through the Senate. But I do several key things. One is it's trying to do is to set up some regional health authorities within across the state. So there'd be, I'm trying to get the proper term for them, but 4 kind of governmental health districts across the state that would be set up, I believe 2 in Eastern Washington and 2 in Western Washington. And these special boards would be trying to evaluate kind of health status within the community and identify needs, and to try to identify ways to help for the counties to work to identify those. And these would be staffed by people from the State Department of Health, and the whole process that they would be using would be established by actually a committee that would be working to identify the exact authorities and methods that they would be using. They also would be trying these regional districts. They'd be identified. Excuse me, I'm stumbling a little bit here. Again, to identify services within the state. There'd also be another group that would be appointed by the State Department of Health that would be looking to identify needs within the state that need to be addressed, and perhaps they could be identified and worked on by the regional committees. Another big thing that the bill would do would be to require that local boards of health change their membership, or at least to have membership that's set up to have an equal number of representatives of, I guess, the general community as well as elected officials. So that would be a big change for us here in Thurston County and many other counties and health districts across the state. There are some that are already set up this way, so the changes would be fairly minimal for them. But in our case, that would be needing to add representatives, an equal number of representatives as those who are elected officials. So that would be a big, significant change. The other part of this bill is that if it recognizes that the legislature may provide funding for foundational public health services, and what the bill identifies as a distribution method that needs to be set up for that. So it says that if more than $60 million is provided for funding for foundational public health services, that, excuse me, I gotta get my number right. I may have missed that number. Now, if more than $60 million is provided, then 65% of that goes for shared services. So one of the things the bill anticipates or believes that there's a need for is that to make the governmental public health system work better, government systems need to share certain services. So for instance, epidemiologists or toxicologists or something like that, maybe a small county needs that on occasion, but they wouldn't want to hire maybe a full toxicologist to be able to have services where they could, that are shared so they could meet the needs of the community without having to have their own staffing. There've been other examples of that, for instance, on tuberculosis response with Seattle-King County playing a lead in that. There's other examples of that that have taken place, but that's one of the key things is to the way this bill is set up is it sets a distribution method if a certain funding threshold is met. So right now, like I said, the bill has gone from one that would have originally required actually broken up local health jurisdictions and put them into regional districts. Now it's having this more, again, a regional advisory, a regional board with us. Actually, one other thing I forgot to mention is that each of these 4 districts would have an assistant health officer from the State Department of Health to provide services within them. And one of the reasons that's being done is, or recommended, I believe, is because what the COVID pandemic and others have shown is that when you're really in a long-term response or when something big happens within your community, you may need additional assistance. You might be able to need someone to provide assisting, say, Dr. Abdul Malik, or in the case of someone in Eastern Washington, maybe they could use assistance. They would not overrule the authority of the local health officer, but they would be providing assistance for that. They could also provide training or backfill for them if someone was on vacation or was ill. So that's a service that was identified that would help a lot of jurisdictions, and so that's also included within the bill. Associated with, so I think that's the bill in a nutshell. I don't know if you have any questions, or if Schelli or Dr. Abdul Malik want to add anything about it.
Okay, they're shaking their heads, so I'm going to ask the board if they have any questions. Commissioner Edwards, questions for Art on 1152 or any of the other items he picked through?
No, I don't have any yet. He's doing fine.
No questions for me, sir.
So I have questions about the Board of Health. I'm really curious about this. So if the bill were to be passed in its present form, does it say that we have a deadline to make this change? How fast do we have to act to expand our Board of Health?
You would have about a year. You'd have until, I think, July 1st of 2022 to reestablish the Board of Health.
Okay. And is there any more you can say about the range of choice? I understand the principle of electeds can't outrank non-electeds. My understanding is that there's a provision, something like that, would limit certain fee fees to the elected members or something like that, decision-making on fees. But what other guardrails are in there? I mean, how big can it be? How small can it be? Or what kind of, do you have to have a tribal member? Do you have to have a doctor? Do you have to have a municipal elected? I mean, what are the guardrails that you get?
Okay, so you were mentioning the thing about fees and charges. There's a provision in there that says that decisions made by the local board of health related to setting or modifying permits, fees, licenses may only be determined by city and county elected officials that are on the board. So there's concern that, imagine that when I retire, apply to be on our local board of health. They wouldn't want me, unless I was an elected official, trying to make decisions about fees. They'd only want the folks who are elected who have that kind of a responsibility to the electorate to be able to do that. But what it does say is that they've got a couple of categories of folks that they want for the Board of Health members. So it says board members who are not elected officials must be selected from categories. So they have public health care facilities and other experts. So that could be, epidemiologists or doctors or healthcare workers, physicians and other folks. There's also consumers of public health. So that would be maybe folks who are licensed. So for instance, a septic system installer might be someone that you have, or a nutritionist or someone like that. Other community stakeholders, maybe there's a particular issue that's being addressed or worked on by the board or that's affecting the community. You might bring in a community member who has expertise or is being affected by a policy decision. And so you could bring them in as well. You can also have nonprofits and others involved with it. But the way they've set it up is that you can't have more than one member from any of the selected groups, and that there's supposed to be an equal number of, you can also have cities represented. That's a common thing. But you have to have an equal number of elected and non-elected members. It does give you quite a bit of latitude. I don't recall seeing where there's a maximum number, but I could check.
No, that's useful. The buckets and having one per bucket, I mean, that gives me a sense of what the structure of that is. And you'd have plenty of time to hash that out. So that's what I wanted to know. Okay, great. What else? So is that going to be the major piece of, that plus the funding? I know they're kind of being talked about together.
So that's the major thing, and I may have misspoke. I think the funding comes in if there's not $30 million, then they have null and void clauses that apply to this. And so, anyways, the other piece, like you mentioned before, Commissioner Menser, is the funding piece. It's the current bill as it that would be proposing funding for foundational public health services would be a charge on people who are insured, and so the mechanism or the amount has changed, and that particular bill has not passed out of its financial committee yet, but because it's necessary to implement the budget, some version of it will stay alive. The proposed version would provide $100 million per biennium beginning in 2022 or 2023, and then that would increase to up to $200 million in the next 4 years, or 4 bienniums, so up to 2026, But whether or not that one passes, or that particular formula passes or something else, it's hard to tell. There's also another bill that's proposed to put a tax on sugary beverages. I don't know if that one has any legs or not. It hasn't gone very far, but sometimes when those concepts get introduced, they get brought up somehow in the budget deliberation process.
Sugary beverage tax in order to fund foundational public health?
To fund certain health services and things, yes. I don't know that one. I don't know that one has much of a chance, but the one that is receiving most consideration is the one that would be a charge for on basically the insured individuals. And I think the logic there is that if the public health system is doing well, then that reduces the need of people to go in to be able to, have, medical procedures and stuff. If you're taking care of yourself, if the public health system is working well, then that might reduce your need to be able to do there. So there's the link between insurance and public health.
Okay.
Everybody's frozen. Oh, no, they're live. Still good. Yay.
There's been discussion at, I'm on the legislative steering committee for WASAC, and there's been discussion about amongst the commissioners about the linkage between the funding and the policy changes, and whether or not, I mean, at the beginning, there was very vehement opposition amongst the commissioners to the districts and the lack of local control. But as those provisions have been whittled down and watered down and made less onerous, and in some ways, WASAC's concerns have been addressed, then is what's left objectionable enough to not want to sort of support the package if it means additional funding? And there's been some talk back and forth about that. And then talk about whether or not those will be de-linked at some point in the process, so.
Yeah, it is really a process. And as you indicated, Commissioner Menser, there's been a lot of iterations. And I know the staff from Wasalfo and the legislative technical expert that they've got working on that have done really a lot of work. And there's been some members of the Senate who've been trying really hard in-house to try to figure out a way to make, as you described, something that's workable for everybody. It's quite a battle. And there are, and I think some of the origins of this are, certainly if you've read the news about how certain boards of health have been, or health officers have been dismissed and boards of health have changed and all that. I think that's a lot of the seeding for it, plus the need to provide better support for the local health or the governmental public health system.
Okay, anything else for Art from the board before we?
No, sir.
No, sir. Thank you, Art.
Okay, thank you. Have a good.
Okay, next on our agenda is item 5, Board of Health members, health-related activities. Anything to report, Commissioner Edwards?
No, other than just to help folks find vaccination.
Yeah, you've been very active with that. Appreciate that. Commissioner Mejia.
Yes, I've been very active in that sense. We've received a lot of public comment. I even have the line for public health, 360-867-2610. I can.
You got it memorized.
I've memorized it. I've said it so much. I'm trying to sign up to volunteer this week. Maybe my bilingual skills can be put to good use. But other than that, I'm just trying to direct folks to schedule vaccines. And I feel once it's Commissioner Menser touched on it this morning, people are frustrated and worried, and then once they get that first shot, I feel like a huge weight is lifted off their shoulders. So it's nice to see them after that and see that they've finally gotten it. So, but that's all I have to say. Thank you.
All right, great. Well, as I reported earlier, I got a chance to see one of the county's vaccine clinics in action on Sunday. With Dr. A and Schelli were there. And it was good to just see people and see how it's set up and giving good confidence about how we're ready to start to address this increased supply, which seems to be starting to really flow into the community. And we're excited about that. And then just a lot of WhatsApp meetings. This pandemic, Dr. A, we rely on Dr. Abdulmalik to give us updates on the science, but you can tell by the commissioner's questions, we're all just constantly reading, watching, news reports, because this is just constantly changing. It's just, important part of the job at this point is just to keep up with this evolving understanding, how the vaccine works, what it means for people, as we overlap, how schools are operating. I get the daily report from my wife, who's teaching kindergarten right now, about how that's going, and it seems to be working reasonably well. So a lot of time spent on this for sure. I think across the board, all of our Board of Health members. We're going to move to item 6, which is our director's report.
Thank you.
Schelli? Yeah.
Thank you so much, Commissioner. I apologize for the technical delay. Yes, I have many things about our department that I would like to share in my report today. I'm starting with our COVID response. I know our health officer will be covering more on vaccines and COVID-19 in her report coming shortly. But I do want to say that today marks day 398 since our public health incident management team has been activated here in Thurston County. And I want to say a special thanks because we had Mr. David Schaffert from the Thurston County Chamber and Chamber Foundation here with us today to say thank you so much for an award that Thurston County Public Health and Social Services received from Leadership Thurston County. And this recognition was for our outstanding initiative, inspiration to others, and significant impact made in 2020. And I accepted this on behalf of all our staff and volunteers at the department who have worked so hard and really deserve this wonderful award. So I just wanted to say thank you so much for that. It meant a lot to us. And thank you to the amazing hardworking team that we have at Public Health working on COVID and doing many other amazing things in our department every single day. Also, just wanted to add on that we did have very successful vaccination events over the weekend at the Lacey RAC, Thurston County Fairgrounds, Thurston County Public Health, the Lacey Senior Center, Salvation Army, and we have many others planned coming up here. We also had Miss Chris Wells here with us on the Board of Health today. I want to say thank you so much to United Way of Thurston County for their partnership in joining with us to help provide volunteers to our upcoming mass vaccination events. They provided over 20 volunteers, I think even more than that, at our Thurston County Fairgrounds site on Friday. And it was just so wonderful to see so many community members there to help us. It takes an entire community to get Thurston County vaccinated, and we really appreciate everybody volunteering. And as Commissioner Mejia mentioned earlier about her desire to volunteer, please contact United Way of Thurston County if you are interested, if anyone is interested in helping to volunteer at vaccination events. Medical volunteers, we ask to sign up with our medical reserve for through our Thurston County Public Health and Social Services website. So thank you so much for that. And with that, I'm going to jump into just sharing some other information with you. Our Nurse Family Partnership Program continues to be very busy in supporting parents of young children. They delivered over 318 visits during this last month. They've been doing so using telehealth, and that has been a very successful model. Our Special Recreation Program serves individuals with disabilities, and because of the pandemic, many of those activities had to be suspended over the last year, but we're really happy to report that those activities have resumed, although they are in a remote format. So there are upcoming events to include bingo, social hour, karaoke, arts and crafts, cooking classes coming up. So for anyone who has been seeking out social connections for those with disabilities, please check out our Thurston County website for that upcoming schedule. Our Chronic Disease Self-Management Program also has been offering online classes. In March and April, we have workshops available for people who are struggling with chronic diseases such as diabetes self-management. We also have healthy home and garden workshops, including green cleaning on March 10th and on March 23rd, basics of mold. In terms of environmental health, there was a question that Commissioner Mejia had proposed at an agenda setting topic regarding the status of our lakes and toxic algae. And I wanted to share that as of earlier this week, there are no toxic algae advisories in Thurston County. There is an active bloom at Hewitt Lake. That results showed that toxins were below the advisory level. In January, our staff responded to algae blooms at Long Lake, Ward Lake, and Summit Lake, which I shared with you at our last Board of Health meeting. And December, we had our earliest report of toxic algae at Lake Lois than we have seen in many, many years. We will continue to be monitoring the health of our lakes as we head into the warmer spring and summer months. If people spot a algae bloom in a local lake, we ask that they contact our health department. That is what triggers us to go out and do sampling. So we want to say thank you very much to our public that helps be our partner in watching for toxic algae blooms. We also have a newsletter that we send out to the public, and people can find out more information on our website about that. In other environmental health news, lots of success over this last year. Our solid waste compliance efforts resulted in the removal of more than 1 million pounds of solid waste from properties with solid waste violations. 91% of the septic systems in Henderson and Nisqually have current inspections, and that is the highest percentage ever, and perhaps the highest in any Puget Sound County. And there will be a special Board of Health session tomorrow that will talk more about that program. So we encourage people to tune in for that. Our permit activities have continued to increase, so we are very happy about that. And also, as part of our environmental health team, we have the COVID business group that has responded to 464 inquiries and requests for help and assistance to implement COVID health and safety practices at schools, businesses, community groups, and citizens, and helping to interpret the changing state and local guidelines. So there have been 320 COVID-related requests and 107 complaints that were responded to regarding concerns about masks. This team has been very instrumental in getting all of our schools back up and running with in-person learning. So we're really thankful for that. And also in our food and environmental services, they have conducted virtual kitchen inspections now, and also inspected 100 of our public schools here. So lots of great work happening there. In our vital services program in this last month, 230 birth certificates and 787 death certificates were issued. And then I just wanted to share that when the Board of Health proclaims an emergency or a crisis in our community, it really does translate into action and investments in programs that help the health and well-being of our community. In our housing program, there is a current RFP out for over $8 million worth of assistance to support our housing programs, social service and human service programs, our treatment sales tax, and our veterans assistance funds. Those applications are coming here soon, due April 2nd. So we encourage nonprofit organizations to please apply for that, and you can find more information on our website. As you also heard from our homeless services coordinator, Kaylee Marino, she gave a preliminary report, and we put out a press release this afternoon regarding the point in time count that occurred on January 28th. We did use a different methodology this year due to COVID-19, but it identified 1,145 people in our community experiencing homelessness, including 169 in transitional housing, 337 in emergency shelters, 639 people in sanctioned and unsanctioned encampments, RVs, and other structures not meant for human habitation, and an estimated 121 individuals who stayed at local jails or hospitals with no home to return to. In our opioid response program, we are continuing to prepare to present later this year to the Board of Health an updated opioid response plan, and we've had many people engaged in our community working on that, and also provided naloxone training to Gravity School's True North program, as well as many other trainings happening in our community. So lots of great things happening in addition to our vaccination efforts. And I just want to say thank you again to all of the incredible staff and volunteers that help us to achieve our mission and work towards our mission of working together to achieve the highest level of health and well-being for everyone in Thurston County. Thank you.
Questions for Schelli from the board?
Yes, I do.
I do too.
Right,
Go first.
Schelli, has there been a spike in deaths in Thurston County over the past year that this COVID has been active? In other words, I mean, do we normally have 400 people die in the county or something, and this year we've had 410 or what, you know, something like that? Have you got a comparison? You know, you must, I don't know, make out death certificates maybe or something. I don't know how to do it, but have we got a difference there?
I do not have the comparison to other years available, but I'm certainly happy to look at that and come back and share that with the board.
Okay, thank you.
Yes. So I have a question that a constituent made. I thought it was a really good question. So Panorama, through the Department of Health, got their vaccinations, and they had the National Guard do it. I am wondering why is it that we do not partner as well with the National Guard? Is it in terms of financing? Would it be more expensive to partner with them, or is it, I know that the Department of Health is partnering with them, but the question is, why are we not?
Thank you so much. That's a great question, Commissioner Mejia. We will certainly request the help of the National Guard if we need it to administer vaccines, but because we have had so many staff and volunteers able to support our vaccination efforts thus far, we have not needed the assistance of the National Guard. The National Guard is activated for the state of Washington, and they have been deployed to the state-run mass vaccination sites, and Washington State Department of Health did use them to help to do some vaccinations right here in Thurston County, which we're so grateful that they were able to do. That is certainly a resource that can be requested in our community if we need it, but our issue really has not been in terms of deploying help for administration of vaccine. It's really been the vaccine supply. And as we anticipate our vaccine supply increases, we have plans to have lots of partners in our community ready to assist in us administering that.
As a follow-up to that, you know, especially right now as we're seeing an increase in the availability, and you know, is there a concern? I mean, do we have to contract out with the National Guard? Is there a fee amount? Because I'm thinking about all the overtime some staff have to take to be able to assist with some of these mass vaccination sites.
To request a National Guard activation or deployment in a community involves a process with elected officials to request that. We can also request that through public health if needed. And again, should our vaccine supply be so plentiful that we are not able to distribute it without the assistance of others, we would most certainly request that. That is a resource that is available throughout the state of Washington to communities that need it. And I know, however, that they are deployed and activated in many different areas of our state right now.
Thank you.
Thank you, Schelli. Let's go to our final agenda item, which is the health officer's report. We have Dr. Abdulmalik with us.
Good afternoon, commissioners. We are experiencing a decline in case transmission rates of COVID-19. So 103.9 cases per 100,000 over the past 14 days. And as of today, which is a little bit, as of today on the governor's risk assessment dashboard, 3% positivity. So this is a remarkable decline in COVID-19 activity in our county. To date, I wanted to give a little bit of some information about COVID-19 vaccinations in our county. So to date, 62,225 doses of COVID-19 vaccines have been given to Thurston County residents. 43,854 individuals have had at least one dose of a COVID-19 vaccine, which is 15.34% of our population here in Thurston. And 26,110 people have received second doses, and that represents 9.14% of our population. Our allocation continues to increase, with more than 8,000 first doses in our county this week, as well as 1,000 second doses in our county this week. We currently are, as all vaccine providers are in all counties, we are adhering to the Washington State Department of Health vaccine allocation guidelines, which is based on the CDC and National Academy of Science and Medicine vaccine allocation framework. So right now, we are vaccinating folks in phase 1A, healthcare workers, medical first responders, and people who work and live in long-term care facilities, as well as phase 1B tier 1. So individuals over the age of 55, individuals over the age of 50 in multi-generational households, pre-K through 12th grade educators and staff, as well as childcare staff. And I did want to mention that the inclusion criteria for childcare staff has significantly broadened per Washington State Department of Health. So it includes not only licensed childcare providers, but licensed exempt providers that accept the Working Connections Child Care Subsidy, the ECEAP Washington State funded preschool providers, which is analogous to Head Start, and license exempt school age and youth development providers. We in Thurston County, as well as the state, err on the side of inclusion, and these are the folks that are currently eligible based on the latest guidance. I do want to. I know that that folks can get connected with vaccine through Vaccine Finder, which is linked to Phase Finder, and can be accessed by computer. However, there are also 2 phone numbers for folks that are having a hard time using the internet to access vaccine. There is the State Department of Health hotline, which is 888-856-5816. And then there's our helpline here at Thurston County Public Health and Social Services, which I know Commissioner Mejia has memorized by heart, 360-867-2610. So those are 2 ways that folks can get assistance in getting vaccine if they're not able to access appointments through the internet. So community transmission rates are declining. We're getting increased supply of vaccine into our county. All of this is very hopeful. However, you know, we all still need to continue to be cautious, especially in public spaces. So it is just as important as ever to avoid large gatherings. We all have to continue wearing our masks in public spaces and maintaining that 6 feet of distance. And really, essentially, regardless of vaccination status, if you're feeling sick, please stay home and please get tested for COVID-19. While we are getting more and more data that transmission risk is significantly decreased after vaccination. So the latest CDC data that was released, I believe yesterday, if memory serves, shows a 2/3 reduction in transmission rate for folks that had the Moderna vaccine and a 74% reduction in asymptomatic transmission for folks that have received the Janssen vaccine or the Johnson & Johnson vaccine. So while that risk is low, it is not zero. And so while we learn more and work together as a community to get everyone who wants vaccine vaccinated, and work to get our community to have sustained low transmission rates to permit a safe return to public life, we are still going to need to be extraordinarily vigilant in maintaining all of the safety measures that we know work in stopping the spread of COVID-19. In light of, I have been asked about, in terms of asymptomatic transmission after vaccine, I've been asked how that compares to other vaccine preventable diseases. And to be quite frank, the answer is definitely complicated. It depends on the disease and it depends on the specific vaccine. What we're one disease process that may shed some light is the pertussis vaccine. So you often get it with your tetanus and diphtheria shot. So it's a three disease combo vaccine that is provided to children and adults, and we receive boosters of it over time. But folks who have the pertussis vaccine are significantly less likely to get symptomatic pertussis. If they get pertussis, the symptoms tend to be more mild. However, there is some asymptomatic spread of pertussis even post vaccine. And for those that don't know pertussis by its scientific name, the disease that I'm referring to is whooping cough. So we do get episodic outbreaks, and it's definitely a vaccine preventable disease, but there is some asymptomatic transmission that does occur post-vaccine. So we're still figuring out for COVID-19 what that asymptomatic transmission and mildly symptomatic transmission looks like for this specific disease. And the most recent data that I just shared from CDC is hopeful that there's a significant reduction in asymptomatic transmission. In light of this, the CDC has updated its guidance for individuals. So when we're out in public, we all need to continue masking, distancing, continuing our respiratory etiquette and all of the hygiene practices that we've been following. But folks that have all been vaccinated, and that definition is folks that have had either both doses or a single dose of a single dose vaccine and have had a period of 14 days after that last dose so that the body can build up all the antibodies that are protective. They can meet in one household to one household, small groups, and without masks or social distancing where everyone has been previously vaccinated. In terms of folks, in terms of mixing with folks that may not have had the opportunity to be vaccinated, the most important thing to be mindful of is the risk of getting sick to the people who are unvaccinated. So the CDC, as well as the risk of transmission overall. So in order to limit that risk of transmission, visitation and groups should be limited one household if one is thinking about potentially relaxing the masking and the distancing in small groups indoors at home. But if a group of vaccinated folks, so namely one household of vaccinated folks, we're going to visit healthy, unvaccinated folks who are at low risk for complications of COVID-19, they would be, the CDC is permitting folks to visit without masks and distancing. One of the specific examples, the reason I bring this up, is visitation between fully vaccinated grandparents who would be at high risk. So that means that 2 weeks after a complete series of COVID-19 vaccine, whether it's a 2-dose series or a single-dose series, visiting healthy young ones who do not have symptoms of illness, who are unvaccinated, so that visitation can take place according to the latest CDC guidance. So that's hopeful, and I know that as we've all been vaccinating over the weekend, I've heard so many people say, now I'm going to go visit my grandkids, and I have been telling them, please wait 2 weeks and then do it safely. One household meeting another household in a private area. However, I did want to mention that not everything that we do here at Public Health is COVID-19 related. So our disease control and prevention team has investigated 110 confirmed and suspect cases of a number of communicable diseases, including Campylobacter, chlamydia, giardia, gonorrhea, chronic Hep B and Hep C, antibiotic-resistant organisms, herpes, Legionella, pertussis, Salmonella, Shigella, syphilis, and TB, in addition to continuing to support our COVID-19 efforts. I also wanted to point out that we continue to have a very, very mild influenza season, which speaks to the efficacy of masking and all of the mitigation measures that we've been doing, distancing and the enhanced cleaning that have been ongoing throughout the pandemic. So there have been 0 lab confirmed influenza deaths for the 2021 influenza season to date. And there have not been any outbreak of influenza-like illnesses in long-term care facilities, which is pretty incredible. So overall, we are in a good place. Things are looking hopeful, but it's really up to each and every one of us to continue to stay vigilant and practice all of the mitigation measures that we've been doing in recent months. And with that, I welcome any questions you may have. Thank you so much.
Mr. Edwards for Dr. A.
No, I'm fine. Thank you.
No questions.
Okay, I don't either. We're almost out of time. It's 4:53. Schelli, any last item? Are we ready to adjourn?
We are ready to adjourn, sir. Thank you.
Okay, I'd like to thank everybody from the public who came, testified, listened in, participated with us. It was a big day for the commission, I think, in both of its meetings today. And with that, we're adjourned. See you tomorrow. On-site septic.